Hi, I'm Mary DeVilliers, and I would like to address the aspect of insurance reform included in the newly implemented Affordable Care Act. This bill has opened our eyes to what was wrong with the healthcare system prior to its passage. In looking back at history, the Employee Benefit Research Institute states that sickness insurance was originally used as a recruitment tool in the 1940s to entice scarce laborers to available jobs. In its original form, insurance was a benefit, not a requirement. However, over the following decades, it became viewed as an obligation of employers. Concerning insurance reform, Sarah Fontenot states that as a country, we have unintentionally and incidentally created a society of overindulged consumers who have high expectations with little financial responsibility. The astronomical cost of healthcare has become a rude awakening for Americans. Our country has been forced to open our eyes to the amount of money involved in the provision of quality care that is straining to keep up with the rapid growth of technology and the aging of the population. According to Bodenheimer and Grumbach, reformers have tried to pass a national health insurance program for 100 years, giving people a guarantee of insurance for basic health care. It is a noble idea for Washington to attempt to provide what is best for the people of this nation, but Washington as a whole has proven that collectively you have poor financial planning skills. I would like to see more reliance on the wisdom of financial analysts and planners in implementing such a huge reform bill. Another aspect of insurance reform that should be addressed is the fact that insurance companies consistently push for laws that limit compensation to certain individuals, yet pay their executives astronomical salaries. According to the Americans for Insurance Reform website, the Securities and Exchange Commission reported that 146 insurance executives were paid over $5 million in 2011. The highest paid insurance executive received over $23 million that year. Perhaps some form of control could be placed over this imbalance and insurance companies held accountable. Regardless of political party or status, every one of us is living life in a body that is gradually aging. At some point in our lifetime, every one of us will face the need for some type of medical care. Please consider how you would like insurance reform to affect you and your family. And lastly, I would like to mention Medicare protection. I have noticed in my experience that patients are getting older and older, however they are not getting any richer. Should this plan bankrupt Medicare, it would be devastating to the majority of the people I care for on a daily basis. But not only do I dislike what it will cost my patients, I dislike what it is costing my employer. Due to the increasing deductibles and decreasing reimbursements, in the hospital I work for, I have seen significant staffing cutbacks, a hiring freeze, and supply reduction over the last 6 months. Staff members have quit and they are not being replaced, which places added burden on those of us who remain. We are now caring for more patients with less staff and fewer supplies. I have also seen some very talented and loved physicians either retire early or go into another profession. One of my favorite ENT docs recently retired and now works as a security guard. A surgeon and an anesthesiologist I respect greatly have both retired in their early 50s. What effect is this going to have on meeting the needs of the people in our community? The number of medical professionals available to care for them is declining. This is due in part to the Medicare crisis. However, as a future nurse practitioner, I look forward to the fact that I can absorb a small portion of that burden. I've learned so many things from this class and I have truly enjoyed it. My favorite discussion board topic was on ethics. I learned that everyone sees things differently and finding the right solution is not always easy. I now understand how policy becomes legislation, then regulation, and I understand how important it is for medical professionals to be actively involved in bringing health policies to Washington, and I am willing to be a part of that. I have also learned many things from studying the finer points of the Affordable Care Act. Watching the videos of the bipartisan meeting was frustrating, yet encouraging at the same time. I understand the process of law a little better now and hope to find my place in the provider gap as a nurse practitioner. Thank you.